Hello, and thank you for joining us today. And either it's good morning or good afternoon, depending on what part of Canada you're joining us from. Thank you for your time. I am Tanya Sherry, and I'm the Director of the Health Leadership and Learning Network here in the Faculty of Health at York University. And I'm really pleased to be hosting this webinar today. It's been months in the planning, and due to the impetus, of course, of COVID-19, I think we got it going even faster than it would have been done without COVID-19. So welcome, and to make sure you're in the right webinar, you've joined us for Turning Point 2020, Enabling Talent Transformation, in a time of disruption. And this is a great time of disruption globally for everyone. Just a little bit of etiquette before we start. If you have just joined us, kindly mute yourself and make sure your video is off. If you have a question or a comment to make, there is a chat line. And your chat can be located in your command bar. If you're brand new to Zoom, it looks like a little question box. You can open that up and type your comment or question. We hope to get to some of the points you may be making or questions you may be asking in that chat line based on the questions that our panelists will be answering. It's a tight 1 hour time period, so we may not be able to address your questions directly, but certainly if we can, we will try. And if not, then we have another opportunity to meet with you again. And now I see all of our panelists are online, so I'm going to start introducing them. And all of our panelists have real depth and breadth of knowledge in education as educators, as well as deep experience in practice in the industry of healthcare. And I'd like to start by introducing Rosemary Core. Rosemary has worked for nearly 2 decades as an acute care nurse practitioner and wound care specialist at the London Health Sciences Centre. She's an adjunct professor in the Faculty of Health Science at the University of Western Ontario. And since 2006, Dr. Kohr has taught in the master's program at the Centre of Nursing and Health Studies at Athabasca University. For over a decade, Dr. Kohr has provided education and consultation focused on quality improvement in healthcare organizations, including patient navigation, nursing best practices, and chronic wound care management across Canada. She is the program director for our patient navigation and wound care certificate here at York University in the Health Leadership and Learning Network, where she's been working with us for the last 6 years. I think it's 6 years. Could be more.
I think it's more.
I think it's more. I'd like to also introduce Jamie Campbell, who's joining us today. He is the director of the Center for Professional and Organizational Development at Sheridan College here in Ontario. Jamie has over 25 years of experience working with individuals, groups, and organizations in facilitating learning, change, and growth. He has an extensive background in learning and organizational development, most recently as the Director of OD and Volunteer Services at North York General Hospital here in Toronto. Jamie has also held the positions of Acting Chief Human Resources Officer and Acting Director, Quality and Patient Experience for a period of time with that same organization. Additionally, Jamie was the Director of Organizational Development for Health Quality Ontario and the Scarborough Hospital, again here in Toronto. He began his career as a teacher and started his OD career as a staff and organizational development consultant with the York Region District School Board here in Ontario. He's also been a faculty member with the Canadian Medical Association Physician Leadership Institute since 2010, and his area of focus with the PLI has been on managing people, self-awareness, and emotional intelligence. He has a solid reputation as a keynote speaker, facilitator, and presenter. Another good reason why Jamie's joining us here today. And lastly, I'd like to introduce Chris Irwin as our panelist. Chris is the principal at Measure of Success Incorporated. You're the principal owner, a consultancy firm that partners with organizations to support, monitor, and improve performance by aligning with activity priorities. He spent the first years of his career living and working in Japan. where he was involved in training and development such as skills, language, cultural training, and curriculum development, as well as in communication, working with stakeholders for stakeholder management, writing, and translating. This included his time at the Disney entity that oversees Tokyo Disneyland. So you can see a real global reach in Chris. He has since held various roles in the social sector and broader public sector, as well as in the private sector in sales and business development. He brings his insight into collaboration as a university lecturer and professional trainer, as a coach at the Mind Gym, where his client experience spans industries and geographies. It's global in nature. He has been with the Health Leadership and Learning Network with us since 2008, where he is our program director for our leadership programs, our Director of Care Certificate in Clinical Leadership, and our Clinical Leadership Program. In addition to being an educator, Chris is also a lifelong learner himself and can be often found with a book or a notebook in hand. I have seen this for myself. Chris has an MBA from our program on campus from Schulich School of Business. And lastly, but definitely not least, Stephen Hurley. I'd like to introduce you to our chair for our panel today, Stephen Hurley, who's the founder and chief catalyst at VoiceEd Radio Canada, a live radio and podcast network dedicated to deepening and broadening the conversations we have about education in Canada and beyond. I think Stephen was an excellent choice for our panel leadership today. Stephen has over 30 years experience in Ontario's public education space and now spends his time nurturing and connecting conversations across the country and around the world. He's really ideal for this conversation today. So I'd like to throw this over to Stephen and welcome our panel, and welcome Stephen.
Thank you, Tanya. I think, Chris, had I known you were involved with Disney, I would have started with a chorus of It's a Small World After All. But instead, maybe I would like to begin with something that I used to begin my teaching year with, and this year students are in various contexts, but I still go to T.S. Eliot for some framing. And so this quote, "We shall not cease from exploration, and the end of all our exploring will be to arrive where we started and know the place for the first time." And I think in this moment of crisis, this moment of unprecedented crisis in our own lives, it's good to sort of step back and understand that we know this place very well. I don't know healthcare as well as I know education, but you know healthcare and you know it extremely well. It's very familiar. So we'd like to trouble that familiarity a little bit today and look for some of the language and the trends and the ideas that are coming forth, not only because of the current crisis, the current pandemic situation, which no doubt has affected healthcare more than any other institution in the world, but trouble some of the language we use. And I'm going to channel Avril Lavigne, who used to say that it's complicated. And I think that healthcare, among other institutions, is actually begging us to use the language of complexity more than it being complicated. And so that language of complexity, where we don't know all of the answers, we don't even have all of the questions, and we don't know which thread is going to lead to another thread. It's kind of this Gordian knot that we try to untie. So healthcare, and so that's what our conversation is about today. We want to focus on leaning into the learning and leaning into a way that is informed by some of the changes that were afoot before the pandemic, but have it been amplified or at least laid bare because of the pandemic. And so our conversation is going to focus today on how healthcare professionals are drawn into that learning system, the changes in the way that those professionals, like you, are trained, and the changes in the way we look at that ongoing professional learning. And so those are the three areas that we're going to delve into. Just a couple of things. Tanya has mentioned that there is a chat window that you have access to. We invite your comments, we invite your questions, understanding again that we have limited time. We probably won't get to a question and answer specifically, but we would like to be informed by those questions and hold them in front of us. About halfway through our session today, we're going to go to Tanya and ask for just feedback on what some of those questions and what some of those emerging themes in the chat are. And that will be used to inform future webinars and future conversations with this group and beyond. So I thank you. It's an honor for me to be here and to work with these fine folks and learn from them. And in learning from them, I'd like to first ask all of our panelists, when you look around the healthcare landscape these days, what are the key shifts that you began to notice before the pandemic and maybe are noticing in greater detail and greater relief now that the pandemic is with us and doesn't really show any signs of letting up in the near future? Rosemary, why don't we begin with you? What are some of the shifts that you are noticing in this time in the healthcare, in particular in the way that we're educating and talking about educating professionals?
Thanks, Stephen. I think that this whole construction that we're talking about is really interesting when we talk about, you're talking about crisis. I see it really as an opportunity as well in terms of how we learn. One of the big things that I would say has happened even over the past decade is a shift in demographics in the profession, in the nursing profession in particular. And, I'm speaking as a nurse and as an educator for nurses. What I've seen is that there is, we have an older workforce in nursing. We have an older workforce, and our patient population is kind of following along those lines as well. So a lot of the education and the information that nurses want to know about is fairly specific. I think a lot of people have moved out of, there are people with degrees, there are people who have master's degrees, etc. But really what we're seeing is this need for specialized knowledge and generalized knowledge that the pandemic has kind of highlighted in terms of the sorts of activities, learning activities, educational activities that people are looking for. And, certainly speaking for some of the specifics that people are, that nurses in particular are wanting, are ways to communicate more effectively with their patient population, within their communities even. Because what people are seeing, what nurses are seeing, is this anxiety over a situation that is beyond our control in many ways. And like a health, an illness episode or an experience that people have with illness, this has put a lot of stress, I think, on nurses and on healthcare in general to be able to provide support and information in a way that is very different from what we've done before. So part of it, I think, for nurses is learning how to use technology, just as we're doing today, using, webinars, online programs, and speaking as someone who's shifted my program from, face-to-face in-person class to online courses. I see that there is a real thirst for this kind of an approach. So, I think that's one of the really big things is that we're seeing this sort of much more specific, I need to know this, and how am I going to learn it? I'm not, the needing to learn online is a different approach. And for many people, many nurses who are older, this is also a challenge because they're not so comfortable with the technology. So that's, those are some of the challenges, but I think it's also, they're great opportunities for us.
Appreciate you reframing the opportunity piece too, because they're two sides to the same coin, perhaps. Chris Irwin, over to you. What sort of key shifts are you seeing? Is there anything that Rosemary has said that?
Yeah, no, absolutely. And I think I might answer this in two ways. I think there's a bit of for healthcare. I recently went to the dentist. So the specific skills, you're there to get your teeth cleaned and stuff like that. It was actually a much quicker visit because I think things have become very transactional. Like, I think that's part of when we're having to do this online. I think if we were together, this could be a whole morning and we would be drinking coffee and taking breaks and doing stuff. So I think when Rosemary's talking about the specific skills, and Rosemary, correct me if I'm wrong, there are some, like, there's parts of this that are, and in this group, I think we're talking about clinical skills. So these are things that I know when it's change a wound or it's clean someone's teeth or physiotherapist and that kind of stuff. And I think the more general skills become a bit broader, and that would be things like, I don't know, if it's areas around leadership or bedside manner or customer service. Does that, and I think Rosemary, I'll throw this back to you, does that distinction make sense in terms of your discussion of specific to general skills?
Yeah, and that's, I think you're absolutely right. And I see that because, the courses I teach with York are wound care, which is a very specific kind of thing, and patient navigation, which is much broader. So yeah, exactly. And, and I think one of the pieces of this that is so interesting is that because healthcare professionals are liberated in a sense to be able to have relationships with their patients face to face quickly, as you say, it's a much more transactional kind of experience. Many of the people that I've talked to who had these health experiences will say the same thing, that it's actually easier to get in touch with their physician or, to do things. So I think from both sides, there's a real learning curve that is going on, and it's exciting.
Chris, let me ask you about that, because you've mentioned a couple of dimensions that are more relational than competency-based, perhaps. Do you see, and at a time when people need that relationship more than ever because we have been so socially isolated, do you think that one of the shifts is I guess, are we becoming more aware of just how powerful those relationships are and how much we need to bring those into the work that we do?
No, sure. And I think that, and this is the context I think that I pull on in my involvement with the Health Leadership Learning Network is in the long-term care context. So there are definitely clinical things that need to be developed, and there's a whole experience that is largely about expectations and that area. And I think where I come back maybe to answering your question is on the clinical side. This is where, when we talk about the area of where people can get credentialed, like it's clear. I know how to dress a room. Rosemary's distinction, right? Wound care, yeah, I can do that. I can test that, and here you go. Patient navigation, a little fuzzier. So I think those things tend to work together. And one of the things, if your question about the shift, I don't know if this is a shift or just a re-emphasis on a lot of, I think when we're as workers in, as recipients of healthcare, I think we put a lot of faith in the fact that we're dealing with someone that has a designation, like a registered health professional. I'm dealing with a registered nurse, and a whole lot of kind of peace of mind comes with that is absolutely backed up by the rigors of the accrediting agency. I don't know if you can get away with not sort of delivering on the more experienced side if you're doing a good clinical job, right? Like, my wound is treated. That was number one. Was it a great customer experience? It was okay, but my wound's done, not a problem. So I think that in this area, that the clinical skills, they're always a given. I think it's there may be sort of new pressures on the other side, which I guess out of a clinical context, you talk about customer experience. We talk about patient experience. And Stephen, you'll tell me if I haven't answered your question.
I'll probably just mute you. But I did want to. I see Jamie nodding his head there. I wanted to go to Jamie. Your thoughts on this dichotomy or the different dimensions that we're talking about here?
Yeah, well, not surprisingly, my training primarily, even though I've done some HR work and quality stuff, is around, organizational development. So, how you do the job is just as important as what you do. And I think that's always been true. And I think it's true. It's feeling more, it may feel less like this at the peak of a crisis where, to Chris's point, wound got fixed, but over time that will not sustain. Like, we'll move back into some sort of normality. And I think people in the system may have changed much more on patient experience component and the skills related to that. And that's not just working with patients and families and caregivers, that's working with your colleagues. There is no, when you talk about complexity of healthcare, in any meeting, you could have 15 people with 15 different certifications and college arrangements and whatnot. It's a very different professional environment that way. So I think the how you do your job is always important. I think it's going to be more important, or increasingly important.
Jamie, do you think we've become more aware of again, back to that word complexity in terms of healthcare? It's not just the trained professionals that are participating in the care of, let's say, seniors in our communities or young people in our communities. Do we need to open up our sense of what we mean by healthcare to allow for that acknowledgement?
Oh, I think so, and I think probably Rosemary would have a better perspective than I might on this, but I just look at all the changes that have happened in the last few years around how healthcare is organizing itself across different organizations, and some of those other elements that are that way, that it's inevitable in a sense, in the direction that we're going in that it isn't just the healthcare professional. This is another webinar, I guess, but how we interact with the other caregivers, the navigator role, which I know people on this call are involved with teaching, is so important. And the folks that go into the navigating roles can come from a variety of places. When you open that up, it's in a complex system, those sorts of roles become more important. Mm-hmm. And it's not going to get less complex. So
I want to come back to you on the HR piece and that thread, but Rosemary, comments on that.
Well, and I think one of the big things that we've seen evolving is exactly what Jamie's talking about, which is there's a change in who's delivering what. So, the lay navigator, for example, who is not a healthcare professional, isn't a regulated healthcare professional, or the personal service worker. There are a number of different roles. And I think one of the things that we see is this sort of shift in who's doing what or how that's shared across the board. So a lot of the work, I think, that is being done is being recognized as things that can be done by someone who is not necessarily a healthcare professional, who has training, but is not necessarily, regulated healthcare professional. And I think that's a good thing myself. I mean, in the same way that, 100 years ago, physicians were the ones who did blood pressure readings and gave injections. Now, that's something that a secretary in an office can do blood pressure. A pharmacist will give, or a pharmacy assistant will give you your flu shot. So, I think the task pieces of this have changed. And part of the way that that's been able to happen, I think, is the fact that we have better access to technology. This kind of, I really think that this is liberating. And it's great because when you start to see the kinds of changes that are happening because the pandemic has kind of pushed us in this direction, it's a direction that I think we probably really needed to go into. So, I see this as being a very, I keep saying it's a really positive, I know it's a terrible thing, but it's also a really positive, there is that positive side to it.
I want to take a look later in our conversation about the newly developing skill sets and how that landscape is changing. But I wanted to go back to Jamie, because you have a lot of experience in HR, and certainly we know that health organizations, whether it's an individual clinic or a large urban hospital, HR is important. And I'm wondering how some of the shifts that we've identified, or even ones that we haven't identified, are changing the game for people working in HR and changing the game in terms of the employers and the people that are being brought in as new employees. How does that whole landscape shift in our current context?
Yeah, well, I think there's a few things, and one of them is, in some ways, it's a little bit of Back to the Future. I think some of the things that happened in the past around, how you taught professionals and how you taught different folks in the context of your hospital, for example. I think that hiring the options that I think organizations are going to come up with to recruit people in will be much more varied than they are now. Because my assumption is we're actually going to need more folks in the healthcare system, not less. So that puts into play then, how do we recruit folks? So what was already happening, virtual interviews, those sorts of things, now within the last 6 months are off the chart. And it will be the way we go moving forward. So I think the processes that HR uses on recruiting using technology will be the same, but I think they'll also start to apply that to things that we used to do as well, or still do, but maybe not to the same degree. Look at nurses, for example, and again, I don't want to move into fully this discussion, but the borders are closed right now. And so that changes your pool of who's available and what you might do. So even that has a difference on how HR would look at it. I also think, and again, we talk about how we retain and keep, that kind of culture you want where people feel appreciated and whatnot. I think organizations in healthcare are going to have to be, quite frankly, much more serious about that. And those sorts of things often fall under the HR rubric around what the kinds of things that they would do around that. So I think things that were already under play are going to be more so. And I think we're going to be looking at some ways we used to do things and seeing how we can modify that and using the technology.
I'd maybe like to go back to Chris and Rosemary and draw in that conversation about credentialing and micro-credentialing and how this might change the trajectory of a career, not only once people are attracted to the profession and how they get that initial training, but once they're in there and want to be seeking some mobility and some change within the system. I don't know, Rosemary, do you have some thoughts on that?
Sure. I think one of the big things that people that I keep saying people, but when I'm talking about nurses in particular, are really looking at is how do I demonstrate that I have these skills? And all of these kinds of programs, the Canadian Nurses Association has a number of credentialing programs that are big and take a lot of time, and they require that sort of commitment over a long period of time. The kind of micro credentialing or the digital badges that we're implementing, I think are really responsive to the kinds of needs that organizations have to ensure that the people that they are hiring have that level, that there is sort of a standardized and I feel this is really important, that there is a standardized level, that we are not, that we are creating an environment where our patient population remains safe, because that needs to be sort of our first priority, and that there are specific places where it's really important to have that kind of standardized, a certain standard of knowledge to be able to be confident that we're credible. For organizations, I think things like what I see is, people come into my wound care course or the courses that I teach in wound care with health leadership and learning. And, nurses will say, well, I was told that now I'm the wound care champion. And wound care is something that isn't taught in any undergraduate program for nurses or physicians. So they come out of their programs knowing virtually nothing. And I'm speaking across Canada as, this is the case. So, you have people who really don't know much. They're registered nurses, so they have a certain level of knowledge. And I think it's the same sort of thing when we start looking at other aspects of healthcare, that we're making assumptions that just because you're a nurse, you know this stuff. And these credentialing opportunities that we have with health leadership and learning, I think, are great because they're manageable for people who are in the workforce to be able to do while they are working, you know, that it's something that you can actually be able to do.
I'd certainly rest better if I knew that the lab technician that I was going to knew how to find my vein. And if she was wearing a badge or he was wearing a badge that indicated such, I'd be much more trusting of that. Not to be facetious, but Chris, I'm wondering, Rosemary mentioned that initial practitioner education in those programs. Does credentialing add value to that? Does it change the way we think even about those initial experiences in education that we have?
I'll just say two things on this. Now, going back to a comment Rosemary made earlier about there was a time when only the doctors would take blood pressure. I think there's always conversations of scope of practice. And I think that this is a very useful one. And it sort of begs the question, do you need this credential to perform this activity? And I think some of the pushing down of this is a good thing because it's efficient and you're having someone, you don't need to have gone to school for 4 years and have a rigorous program to do this. To your point of like finding a vein, yeah, like that's something that would be part of this. So I think that that's where there's sort of increased pressure on the clinical credentialing, say like, what am I getting? My frame at this comes from having an MBA and teaching in the MBA program. The MBA designation doesn't mean much at all because there's so many different flavors of it. And you have MBAs who only know financials and you have MBAs that are not strong on financials. But in the clinical ones, it has to be really, really clear what you do. So where does this move from a doctor to a nurse practitioner to a registered health professional, sort of down? And then there's some of the stuff, and I think there's a lot of where we're looking for the efficiencies. You don't need clinical training to do a lot of the stuff that happens in a clinical environment. So that's one point. May I make another point? I think there's a real danger in trying to credentialize something that you can't sort of put your hands on. I was thinking this and I said, I wonder if there's a certificate in being funny. So you're like, hey, I got the funny certificate, right? Does it actually mean I'm funny? I don't know. I'd have to spend some time with you, right, to sort of understand this. And I think there's a little bit of an interplay there where we can try too hard to credentialize. The program that I teach in mostly at Health Leadership and Learning Network is a leadership program. I think leadership is one of those things. Just because you have the certificate does not mean you're a leader. And you can be a leader without the certificate. So that's a little bit of the area that I think we'll continue to explore. None of that is new, but I think there may be new emphasis on some of these areas.
Is there a way into that conversation that we're starting to have now that maybe we weren't before?
So I'm gonna pull on a bit of what Jamie was talking about in terms of like I think employers have a responsibility to sort of nurture and foster an environment. And this isn't just HR, this is everybody, right? So like, let's make sure that, hey, the skills we want, and if we say we're patient experience focused, well, let's make sure that we let people do that and sort of identify areas of skill development and reinforce so that kind of stuff. I think there continues to be a responsibility on employees to seek out some of these things that we need to develop. I know that Tanya Sherry and I talk a lot about this metaphor of the T professional. And this is so you have and I think in a clinical world, your horizontal line would be your designation, your clinical area. So this is like the job that you do. And then the vertical side is all that other stuff, right? Working nice with others, navigating, providing this sort of thing, providing leadership. And I think that that's an interesting split. My lens on that with the leadership program that we do through the Health Leadership and Learning Network is working with directors of care who are in a long-term care context, who are registered nurses. So bang, they've got the horizontal axis. And we just work on sort of awareness around broadening that, understanding that it's a journey. It's the T.S. Eliot journey where you get back to where you started, seeing it for the first time. Like, I think that's a little bit of the space on the horizontal side of it.
And to what degree, using that metaphor of the T chart or the reality of it, that's kind of a two-dimensional diagram. Do we need a third dimension that maybe brings things together in a different way?
Maybe rather than a third dimension, it's just a bit of a shading. And I think some of these things, we remember that and come back, and there's often a balance. And if just in the communications world that I've done, there's always a balance between like being assertive enough but not being too assertive. And I think you never strike the right balance. I think we just continue to err on one side or the other. And I think erring on both sides of one of those divides, I think is probably a really good thing every once in a while, within reason.
As Frank Sinatra once said, how did all these people get in my room? I just noticed we have other people here that aren't showing up on my screen. And I'd like to remind our listening audience that we have a chat window there. And if there's anything that's emerged to this point that you want to ask about or make a point about, maybe something to bring forward to another conversation. I know the issues of micro-credentialing, credentialing, badging is going to be the theme of an upcoming webinar. I think we've just scratched the surface on that, and I feel this need to go deeper, but we're going to move on, and we've kind of touched on some of this already in terms of how the key shifts that we've observed have us talking about some of the new skills, and the new skills not only for people that are graduating from the system, but what are some of the new skills that people that have been in the system maybe for many years need to be, and I don't want to say retooling, but I'm going to use that word anyways. That's not really what I meant. So Rosemary, why don't we begin with you? What are some of the new skills that maybe you haven't identified already that are emerging in the work that you do?
Yeah, I think always one of the pieces, and both Chris and Jamie, you've alluded to this as well, is communication. Part of it too is that we are face to face in a very different way in this pandemic situation. I mean, I'm looking directly at Chris on my screen, and you are, I think that's the other part. I was thinking about this today because teaching online is a very different way of teaching as compared to teaching in a classroom where you're, at the front of the room or you're moving around talking to people. So it's a very different transactional relationship that many people are not necessarily comfortable with, both on the receiving end and on the giving end. And, speaking as someone I did work with the Ontario Telemedicine Network many, many years ago. For 5 years, I did televised rounds once a month. And what I noticed over the 5 years was that at the beginning, nobody wanted to say anything. We had these little boxes on the side so that you could see sort of the organizations. People didn't want to talk. But what I see a change happening now is that there's a much better sort of relationship with the technology, but there is still a real need to develop the kind of communication skills so that you're not delivering the wrong message. I think that's the other thing is that, I talk a lot about health literacy, and I talk about cultural communication, being able to read people. It's very different when you're looking at somebody on your computer as compared to sitting across from them in a room. So I think that those are, some of the really key pieces that, and skill sets, I think, that we really need to be able to develop, along with just being comfortable with the technology and being relaxed. Like, if it screws up, you lose your sound or your whatever, something happens, okay, we're human, like, this is all right.
Yeah, I thought you were talking about something else when you mentioned there are certain things that I don't want to go wrong. But yeah, a Zoom call, that's one of them. It's okay. Jamie, let's go to you on that. What are some of the new skills? And Priya on the chat was talking about the kinds of soft skills that might be necessary. Not sure if you're a fan of the soft designation, but.
No, I don't like that. I tend to call them the hard skills. Around that. So there's a line in the HR world, which actually isn't really that pleasant, which is they say that they hire for competence and fire for character. And essentially what that means in practice is you can give me lots of information about your competence. You can bring me your certificates, you can bring me all of that stuff. I will phone people for, references, etc. There's lots, but it still takes time if you can change character to really more about like, how do you play with others? And so those skills around emotional intelligence, those skills around, being collaborative, giving and receiving feedback, I think are just, core to how we do what we do effectively. And to Rosemary's example, I think it was Rosemary talking about somebody was now the wound care, consultant or whatever that is. We do that and don't give that person any skills around how to consult. Forget about the knowledge. What about how you do the job? How do you actually interact with different professions, patients, and families in a way? So I think that, the obvious ones around being comfortable with technology, being comfortable with kind of virtual pieces. I think those skills around emotional intelligence, how you manage yourself, how you work with others, always important, way more important, I think now. And I think part of that, like forgiving yourself, when things go wrong, I think the whole self-care piece, like I really do need folks to be able to manage themselves and their health and well-being. I will do what I can do as an organization, but I can't do everything. So I'm going to try to recruit people that I think actually maybe have some different skills in that area than maybe I did in the past. It's easier to hire people with those than to train people with those sorts of skills. So.
Chris, so over to you. I know you have a number of things to say on new skills.
May I ask Jamie a question?
Sure.
You may.
Jamie, correct me if I'm wrong. And this is kind of a question. This is a bit me revealing how I think about these things. There is an environment that develops, and I have worked with people who will be very, very combative. And like aggressive is too strong a word, and there's a bunch of stuff that goes on there in a work environment, but you take them in another environment and they're great and they listen to you and they're doing this. So I think that there's, correct me if I'm wrong, a bit of an interplay between the skills people have and the skills that are sort of nurtured, reinforced, and whatever the opposite of reinforce is in a work environment. Would you have comment on that?
Yeah.
Comment?
Well, I absolutely do. And I think the whole concept of intent versus impact is really, I think, kind of a core piece of that, which is it truly may not be my intention to treat you poorly or you may respond to it differently, but it has an impact. I'm much more interested in the impact than the intent.
Sure. It doesn't matter if I wasn't trying to be a jerk.
I don't care what the intention, I can't even get into your head. I don't know. Right. And so there are 47 opportunities a day working in healthcare in a hospital where you can misunderstand what somebody meant and experience it a certain way. So to me, the intent impact conversation is really, really important. And as an HR perspective, again, I'm not that interested in your intention. I'm interested in your impact. Yep, and we'll figure out intention if that matters, but really, it may not. And so if people who say that's just me, et cetera, well, that's not good enough, right?
Or in my experience, more often than not, they say, that's just Jamie. He's like that. Like we've gotten used to him. And again, this is it sort of gets into the water. Yeah. Stephen, may I now answer your question?
Yeah, and then I have another one for you.
I think, and I'll keep this quick. I think just on a skill, and we mentioned this, I think at the very outset, I think Stephen, you used the word complexity. I think that there's a need to be comfortable understanding complexity and ambiguity. And I've heard people say, like, it's really important to know what to do when you don't know what to do. Mm-hmm. And I think that some of these behaviors that get a little bit emotionally charged become with a frustration that people don't know the answer, and potentially just sort of the realization that there is no answer, right? Like, don't worry about it. It's all cool, right? May foster some of the behaviors we talk about. And that's somewhat self-serving because the whole, the complexity sort of lens and what to do and how to manage that is a focus of the leadership program that I'm involved in at York. But Stephen, you had a question.
Well, I wanted to, before I ask you that question, because I think I'd like to bring Tanya in here, who's been monitoring the chat. And Tanya, I'd like to ask if there are any pressing questions or themes that are emerging in that conversation. I see it happening over there, but I can't read it and focus on Chris at the same time. So
there are, and I think you've been addressing them. One comment from Zaid, that he's currently working, graduated from the health management program, but he is a non-clinical person working in a clinical environment with clinical people. There seems to be tension. and how can we address those challenges of working, I guess, on an interprofessional team that includes non-clinical staff, and how do you address the tension that gets created by communication? And I think it speaks to your point, Jamie, about communication skills, and yours, Rosemary, and yours, Chris, about there is a need to better understand what those communication skills are, and for people to get education, get training in them, such as emotional intelligence or managing disagreements, motivational interviewing, ways to manage communication better. And then another question, which is slightly different, around the global shortage in healthcare staff. This is from Yasmina. Now that and this is for Jamie, now with the global shortage in healthcare staff that has been exacerbated by the pandemic, does your criteria change? So I've got those two.
Interesting. And Chris, could we turn to you on that first one about the relationship piece of clinical and non-clinical staff? Because I know you have a real heart for talking about that collaborative piece in your work.
Yeah, no, sure. And I think that's kind of I think if you use a lens of complexity and ambiguity, it doesn't mean everything is complex and ambiguous. And if our friend Zaib is questioning a clinical practice, you have no business questioning that, because we figured that out, and this is how you do it. Sometimes it's difficult to do that, and you need to have conversations about how to enable that. But I think some of the stuff is actually kind of clear. And to Jamie's point, without being a jerk, you can sort of be assertive and say, well, hey, listen, but according to my professional college, I have to do this. Like, I'm the electrician who's come into the room and seen bad wiring. I have a responsibility to do this. And I think there's a bit of delicacy in delivering that message without coming across as a jerk. I prefer someone do their job and be a jerk rather than not do their job and not be a jerk, if that's the fork in the road that presents itself. Have I answered? Yeah, go, please.
That as well. Because I've worked in situations where this kind of thing has come up, and where we talk about, interprofessional teams where it's clear that people are not leaving. I always say, you need to leave your hat at the door in order to really be interprofessional and work together collaboratively. But, I think we have to recognize that there are culture differences. Every healthcare professional organization or institution has their culture. And you can see it really clearly when you're, in a hospital, for example, and you see physicians together, and in the cafeteria, physicians together, nurses together, PSWs together, housekeeping staff together. When they have to work together, I think what needs to happen is we need to pay attention to skills that people are bringing to the table and experiences that people are bringing to the table. For sure, I agree with you, Chris, in terms of recognizing that there are things that someone, a surgeon, I'm not going to perform surgery, hello, that's not what I'm going to do. But on the other hand, there are other pieces that go along with working in that environment that someone else, a chaplain, a social worker, somebody with a different educational experience and background may have more insight. When we have rounds, for example, clinical rounds, the dietitian is asked for input. Every eye swivels to the dietitian when it's about food and the diet, when in fact the dietitian may have some really good thoughts in terms of, this person is depressed. They're not eating because they're depressed. We really need to be looking at, that aspect. So I think we have to be very, very open to each other's, what we bring to the table outside our professional hat kind of perspective. So I think for people who are non-clinical, to be to be put into, well, you're non-clinical, so how would you understand this? I think is wrong.
Yeah, that's almost a topic for another webinar, that those relationships.
Write those down.
Got it written down. Plus, we'll go back to these. Jamie, you mentioned early on that the reality that the borders are closed. That and I think this goes to Yasmina's question about the global shortage. Do you want to comment on that? I'm aware of the time. I don't want to.
Yeah.
Miss.
So I think part of that question had to do with, do your standards decline if you're having to, if you're having to hire in this sort of context? And again, there's a little expression in the quality world about quality, cost, and speed. Pick two. You may not get all three. So I think what you don't reduce your standards. And I was very impressed with the college sector because I've been there through the pandemic. And right away, when they had to switch within a week to a different format, all the way through it, they had all their committees, groups that deal with the integrity of the content right there. Because they said, we're not going to offer something that still isn't good. And I think that's the same as it would be for healthcare. We may have to support people differently when they come in. We may have to increase some support for folks if there are gaps perhaps in their learning, but you do not reduce you shouldn't be reducing the criteria or the standards. Bigger pool, people invited in, but you may have to help them a little bit more when they're there.
Well, that leads into the question that we want to pose in the final reel, and aware of the time coming up to the top of the hour. We have we've talked about people that have just graduated. We talked about some of those new professionals, some of those existing professionals. What about people who are looking to the sector, looking to healthcare as a career opportunity, or that maybe they want to shift, maybe they have experience and credentials in other areas? Are there skills and qualifications that that people from outside the sector need to know about before they consider that? Are there portable skills that they may already have that the sector can be leveraging? How do we look at people from outside and welcoming them in, attracting them to the healthcare system? Rosemary, did you want to start on that?
Ooh, I think welcoming is a really interesting word to use. I would say that one of the pieces that is really important for people coming from other disciplines or other areas is that experiential knowledge that they can bring to whatever that learning environment is. So in order to look at sort of an academic picture, and speaking of nursing, there are prerequisites that people need to have to come into a program. But I think part of what we miss in nursing is that whole piece of experience. So and what I see happening, I teach at Athabasca University in their master's program, and certainly what I see in the master's program is the stories that nurses are talking about, because it's an online university. Stories that people are talking about is their backgrounds often are very, they came to nursing as mature students, and they came to nursing because they wanted to help people, and that was a motivator for them. But it's that experiential learning that I think we really need to, it's not the marks that you get in chemistry or microbiology or whatever, or pathophysiology. It really is, at the end of the day, it's about how you relate to other people. So I think for programs looking at, being welcoming and improving their pool, I think those are the kinds of things that we really need to be focused on, as opposed to just the marks. So, from a broad scale, that's, I think, where we need to go. I'll stop there. This is, again, another sort of, really interesting conversation.
Like one of those 101 first year university or college courses, the survey course. Jamie, you on that, on welcoming, and Rosemary identified it as an interesting word. I'm not sure if that's good or bad.
Well, I may be guessing, but Rosemary may have been referring to, there's again an expression in the nursing world that nurses tend to eat their young, as the expression goes, when they're welcomed in. A little different than education. Education, we tend to baby them the first year or two. Healthcare sometimes can be tough when you're coming in. So I think organizations are going to have to figure that out. They're going to have to figure out ways to truly welcome people, meaning that people that are coming from other sectors or other experiences feel that they matter, that they, you know, that they can trust the organization, that they feel they belong. And the thing I think which is new and added is that they're safe. And I think it's the safety conversation which helps you with the other conversation. Because when you're talking about safety, then you should be allowed to talk to anybody about anything as it relates to that, but having the skills around it. So, you know, kind of similarly, I think you're going to get people that if they have good people skills, if they've got good data skills, if they've worked in environments where, you know, kind of student-centered, patient-centered, customer-centered, I think all of those things are transferable in, you know, for certain jobs and certain roles, you know, but you're still going to have to be competent in whatever that, you know, the other parts of it, you know, of your job or role are. But I think those things can carry over big time.
Chris Irwin, to you on that.
Yeah, no, I think and I'd kind of come back to the welcoming comment, and I think that I think Jamie made the point earlier, the healthcare sector is going to need more people, not fewer people moving forward. And I think that if you sort of know that you're coming into an environment that's not that welcoming because you don't have a credential after your name, you can do some work on your own to be more welcome. And that's often stuff like asking questions and listening and reading the things before you speak, and that sort of stuff that I think comes back to some of the skills that we're talking about. But I think if there's anything, I think that there's a responsibility on the sector to include expertise that's not clinical and not look down on that expertise. But I think on people entering the sector, like there's lots of great stuff in healthcare. Sort of in the context of the program that I'm working in, the long-term care context, there's lots of room for people that are not clinical, and they're sort of like they're business people, like their efficiency, they're about customer service or corporate culture. Like there's all sorts of places I think where people can be involved in the sector without being clinical, and the sector definitely needs people that aren't clinical.
I would really agree with that in terms of patient navigation is a place where you really see that. I mean, you need to have people who have the clinical skills to be able to answer questions, clinical questions, but you really need people who can do that interface, you know, to help to really be navigators with people, and people who come from retail, for example, who have those, you know, built-in kind of, they've spent all that time learning about customer support and, you know, customer service, dealing with angry people or stressed out people. You know, those are the kinds of, we should be encouraging more of that, you know, healthcare without walls perspective.
That's a great point.
Yeah, it is a great point. And for so many students who moving through our secondary system, as you said before, the marks, they can be the gatekeeper that you know, get people's imagination going on what is possible in terms of their career choice. We are kind of out of time here. I wanted to go to Tanya one more time to bring us up to date on any conversations that we maybe need to carry over for our next webinar, maybe some connections between the questions that are out there, Tanya.
There are a number of questions, and if our panelists will bear with us and our attendees, there is a theme in the chat, and I don't know, maybe Stephen, someone can quickly address it, even just touch on it, because it is big. I think it's big. It will take a webinar on its own. And it's around experience and obtaining experience, or if you don't necessarily have that experience, about highlighting your knowledge. And so these are people obviously seeking to get in to their various industries. Any comments? We have someone saying, how would you verbalize or explain your knowledge if you don't necessarily, it's that useful to do that if you don't necessarily have the experience in that field? And these are for our new graduates. These are people who have just finished their programs.
Amy, is that not an indication that you have?
Well, a couple of quick thoughts, because I had volunteer services for a number of years. So volunteer services, for example, in a hospital has changed, you know, remarkably in 10 years, 15 years. And it used to be people were there for 50 years volunteering, and now they're episodic. They want to get an experience. They want to do it for 6 months and they want to move on. So I think those kinds of ways to get experience are still very valid. There are lots of places that are looking for lots of volunteers. And it doesn't have to be forever. It can be for 6 months. They're much more designed to do that now. So I think those still exist. It just takes a little bit of work. And sometimes you may not get exactly a healthcare experience, but maybe you're finding one that's related, it's relatable to it. Because at the end of the day, the only way to get experience is to get experience, which is annoying, but it's true.
Rosemary, did you have a final thought on that?
I think one of the other things too is, the question about how do you kind of explain your experience if you haven't had that clinical experience specifically. And I think one of the ways of doing that is giving an example from your life experience to say, this is how I have learned about managing stressful situations, or because my grandmother, and to be able to put those things in a context that that is relatable, I think is probably something to do. And, we have to get, I don't know, my personal feeling is that we have to sort of get out of the paper-based resume. You read 15 resumes or 100 resumes that all look exactly identical, but really what you're looking for is somebody who's played sports in school and knows how to be a team player. I mean, honestly, that's a piece that is potentially really great to look for someone who's got those additional skills. I think volunteering is a wonderful thing. It's difficult for many people. We haven't talked about remuneration at all. And I do think that's certainly another topic. It's an issue though that also should be addressed in terms of, paying people appropriately for the work that they're doing. And I don't think that necessarily happens a lot in healthcare. Sorry to say. I don't think it happens, certainly from a nursing perspective, PSWs,
We're seeing,
yeah.
seeing that more and more during this time. Chris, 30 seconds to you, and then we'll wrap up.
Yeah, I think I would say that it's a sector that needs people. It's an interesting sector. So just some determination, like keep at it. And maybe that is a volunteer, or take a job that's not your number one choice, but I'd sort of go, and I think I'm echoing Jamie's comment, no experience is bad experience. So take what you can get, back to Rosemary's point, without settling too much, because one can feel taken advantage of oneself.
Well, Jamie Campbell, Chris Irwin, and Rosemary Core, I want to thank you for journeying with us today, exploring very familiar territory, but opening up new conversations and new avenues. We've heard about communication. We've heard about those alternative skills and welcoming people into a profession that is, I would say, likely going to be going through a lot of change. The politics are out there, the economy, the conversations are there. So much more to explore, but thank you for being with us today on this HLLN webinar. Appreciate your time.
And from York University, thank you to the panel. Thank you to everyone who's joined us today. This was recorded, and I believe that we will be making the recording available. Maybe Odette can confirm that in our chat line. And a lot of questions that have been raised, and it does beg for another webinar, so I hope we can get that put together. And please stay tuned, everyone who's on the line, for perhaps another webinar announcement. I've learned a lot too in terms of, as an educator in higher education for professional learning, what we need to pay sharper attention to. So your feedback today on that chat line and your feedback as panelists today is very gratefully accepted. Good, and to all, thank you. Have a wonderful afternoon and a safe afternoon. Take care, everyone.